Sometimes, an injury can cause the humeral head, top of the arm bone, to come out of the glenoid, the socket. Most shoulder dislocations are anterior dislocations, meaning the humeral head comes forward as it leaves the socket. Sometimes, the humeral head tears part of the labrum as it dislocates. This is known as a Bankart lesion. The Bankart lesion can result in the shoulder joint becoming unstable and requiring surgery.
Recently, we had a case of recurrent shoulder dislocation in 24-year-old male patient, for whom we did Bankart repair or labral repair. Here are the results, 3 months after the surgery.